Okay, so now we're going to look at rhythmic stabilizations. So as the name says, we're looking at improving stability. Now, you can use this in any portion. You can use it even in orthopedic conditions. So I can do rhythmic stabilization on the hip, the shoulder, the ankle, the knee. We're thinking, though, we're going to really focus in lab and as your skill check at doing it over trunk control. So we want to improve trunk control. So again, when we're really thinking about this with our patients, most of us, all of us, have decent trunk control. But when we think about a neurological patient, so a patient with a stroke, a patient maybe even with a lower spinal cord who has very weak trunk control, even sitting here, maybe they're kind of slouched like this. Maybe they don't have spatial awareness of where they're at. So we want to improve their trunk stability. We want to improve their sitting stability to cross transfer over into improving walking, dressing, all of those things. So for rhythmic stabilization, I'm going to be behind our patient, Sabrina. And what we're doing is we want to do an isometric contraction. Now, the key is when we think of rhythmic, typically we want to think of some sort of rotation. So when I'm providing this isometric resistance, I want to think about rotating by pushing a force here in a rotational direction to really, really, really make her fire those obliques, fire the abdominals, fire the paraspinals, fire even probably her pecs. All of her trunk muscles we want firing. So what I'm going to cue my patient is I'm going to tell her to hold and don't let me move her. And I'm going to feel and try to match resistance. Now, this is a gradual, this isn't a quick pop, 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 push, 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 push. I'm doing a slow, gradual resistance, and I'm feeling where she feels stronger at. So I might start with a position here and a position on her back. I'm going to tell her again, hold, don't let me move, and I'm going to start applying pressure. Okay, I'm going to keep this force. When I see she can demo good trunk control, then maybe I'm going to do a little bit more force. Now, go ahead, relax. Let's say I'm going to have her demo. She's really pushing into this hand, but not this hand. So she's pushing, push, 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 push. You might also see, I am feeling, Sabrina, I need you to push back as well. Okay, so feel your pressure and also watch their mechanics. If she's starting to kind of move like this, I need to cue her to fire these back muscles, fire her posterior chain. So I might do that for 10, 15 seconds until I feel like she is getting, excuse me, a good isometric contraction. And then maybe I'm going to switch and do my hand placement this way. Okay. But again, think about that rotational aspect. And that is rhythmic stabilization.